Analytical Reasoning. 100 solved MCQs. Some important MCQs may repeat, please tolerate. 1. A hospital purchased 200 boxes of gloves. Each box contains 50 gloves. If the hospital uses 4 gloves per patient on average, how many patients can be treated with the purchased gloves? A. 4,000. B. 10,000. C. 20,000. D. 40,000. Answer is C. 20,000. 2. The procurement department needs to purchase surgical masks. If each box contains 25 masks and the hospital requires 1,000 masks, how many boxes should the department order? A. 25. B. 40. C. 50. D. 60. Answer is B. 40. 3. A hospital has a budget of $50,000 for purchasing medical equipment. The department decides to allocate 40% of the budget for surgical instruments. How much money will be allocated for surgical instruments? A. $5,000. B. $10,000. C. $20,000. D. $40,000. Answer is C. $20,000. 4. A procurement officer received an order for 10,000 vials of a particular medication. The medication is packaged in boxes of 500 vials each. How many boxes should the officer order? A. 10. B. 20. C. 25. D. 50. Answer is B. 20. 5. The procurement department needs to purchase 300 syringes. Each box contains 50 syringes. How many boxes should be ordered? A. 3. B. 4. C. 5. D. 6. Answer is D. 6. 6. A hospital wants to purchase 15 hospital beds. The beds are priced at $2,500 each. How much will the hospital need to spend on the beds? A. $25,000. B. $30,000. C. $35,000. D. $40,000. Answer is B. $30,000. 7. A procurement officer needs to purchase 600 rolls of bandages. Each roll contains 10 meters of bandage. How many meters of bandage should the officer order? A. 6,000. B. 60,000. C. 600,000. D. 6 million. Answer is B. 60,000. 8. The procurement department wants to purchase 100 boxes of latex gloves. Each box contains 100 gloves. How many gloves will be purchased in total? A. 1,000. B. 10,000. C. 100,000. D. 1 million. Answer is B. 10,000. 9. A hospital has a budget of $80,000 for purchasing pharmaceuticals. If 60% of the budget is allocated for antibiotics, how much money will be allocated for antibiotics? A. $8,000. B. $16,000. C. $48,000. D. $80,000. Answer is C. $48,000. 10. In a hospital, 40% of the total staff members are nurses. If there are 200 staff members in total, how many of them are nurses? A. 40. B. 60. C. 80. D. 100. Answer is C. 80. 11. The average monthly expense of a hospital on medical supplies is $15,000. If the expense is expected to increase by 20%, what will be the new average monthly expense? A. $12,000. B. $18,000. C. $15,200. D. $18,200. Answer is C. $15,200. 12. A hospital has 12 operating rooms. Each room can accommodate 4 patients at a time. If the occupancy rate of the rooms is 75%, how many patients are in the operating rooms? A. 27. B. 36. C. 45. D. 54. Answer is B. 36. 13. The inventory turnover ratio of a hospital is 5. If the cost of inventory is $100,000, what is the value of the total sales? A. $20,000. B. $50,000. C. $100,000. D. $500,000. Answer is D. $500,000. 14. A hospital procures 150 units of a medication. If the lead time for procurement is 5 days and the daily usage rate is 20 units, how many units should be reordered when the stock reaches the reorder point? A. 50 units. B. 60 units. C. 70 units. D. 80 units. Answer is A. 50 units. 15. The price of a medical device is reduced by 25%. If the original price was $400, what is the new price? A. $200. B. $250. C. $300. D. $350. Answer is C. $300. 16. A hospital has a budget of $500,000 for purchasing equipment. If 60% of the budget has already been utilized, how much money is left for further equipment procurement? A. $100,000. B. $200,000. C. $300,000. D. $400,000. Answer is B. $200,000. 17. A supplier offers a discount of 15% on the purchase of medical supplies worth $10,000. How much money will the hospital save with this discount? A. $500. B. $1,000. C. $1,500. D. $2,000. Answer is C. $1,500. 18. The average time taken to process a purchase order in a hospital is 3 days. If a rush order is placed, the processing time is reduced by 40%. What is the reduced processing time for the rush order? A. 1.2 days. B. 1.5 days. C. 1.8 days. D. 2.2 days. Answer is B. 1.5 days. Question 19. A hospital has 3 departments: surgery, pediatrics, and oncology. Each department has at least 1 staff member. If the total number of staff members in these 3 departments is 15, what is the maximum number of staff members that the pediatrics department can have? A. 3. B. 6. C. 7. D. 8. Answer is C. 7. Question 20. A hospital conducted a survey of its patients to evaluate their satisfaction level with the services provided. The results showed that 75% of the patients were satisfied with the hospital's services. If 500 patients were surveyed, how many patients were not satisfied? A. 125. B. 375. C. 100. D. 425. Answer is A. 125. Question 21. The average age of 5 doctors in a hospital is 35 years. If a new doctor, aged 45, joins the hospital, what will be the new average age of all the doctors? A. 35 years. B. 36 years. C. 38 years. D. 39 years. Answer is B. 36 years. Question 22. In a hospital, there are two types of beds: regular beds and intensive care unit ICU beds. The ratio of regular beds to ICU beds is 5:2. If there are a total of 84 beds in the hospital, how many regular beds are there? A. 30. B. 35. C. 40. D. 45. Answer is C. 40. Question 23. A hospital purchased 250 boxes of gloves, each containing 100 gloves. If the hospital uses an average of 10 gloves per day, how many days will the gloves last? A. 250 days. B. 1,000 days. C. 2,500 days. D. 25,000 days. Answer is B. 1,000 days. Question 24. A hospital has a total of 120 employees, including doctors, nurses, and administrative staff. The ratio of doctors to nurses is 3:4, and the ratio of nurses to administrative staff is 5:2. How many nurses are there in the hospital? A. 40. B. 48. C. 60. D. 72. Answer is B. 48. Question 25. A hospital administrator wants to schedule 3 different surgeries on 3 consecutive days. There are 5 available time slots each day. In how many ways can the surgeries be scheduled? A. 15. B. 60. C. 125. D. 243. Answer is D. 243. Question 26. A hospital has a total of 80 beds. If 20% of the beds are occupied, how many beds are available? A. 16. B. 20. C. 64. D. 80. Answer is C. 64. Question 27. A hospital receives a shipment of 300 vials of a certain medicine. If each patient requires 3 vials of the medicine, how many patients can be treated with this shipment? A. 90. B. 100. C. 200. D. 300. Answer is B. 100. Question 28. Which of the following statements is true regarding the procurement process? A. Procurement involves only purchasing goods. B. Procurement is a one-time activity. C. Procurement includes sourcing, purchasing, and contract management. D. Procurement is unrelated to budgeting. Answer is C. Procurement includes sourcing, purchasing, and contract management. Question 29. In order to compare the prices of 2 suppliers for the same product, what should you consider? A. Quality of the product. B. Supplier's reputation. C. Delivery time. D. All of the above. Answer is D. All of the above. Question 30. Which of the following is not a common procurement method? A. Request for proposal RFP. B. Reverse auction. C. Direct negotiation. D. Quality control. Answer is D. Quality control. Question 31. What does the term RFQ stand for in the procurement process? A. Request for quotation. B. Request for quality. C. Request for quantity. D. Request for query. Answer is A. Request for quotation. Question 32. Which of the following is an advantage of centralized procurement? A. Faster decision-making process. B. Tailored procurement solutions for each department. C. Increased departmental autonomy. D. Reduced economies of scale. Answer is A. Faster decision-making process. Question 33. Which of the following is a key factor in evaluating supplier performance? A. Financial stability. B. Social media presence. C. Personal preferences. D. Color of the supplier's logo. Answer is A. Financial stability. Question 34. What is the purpose of a purchase order PO? A. To request payment from the supplier. B. To track inventory levels. C. To create a legally binding contract. D. To record a supplier's credit history. Answer is C. To create a legally binding contract. Question 35. What is the purpose of a service level agreement SLA? A. To define the responsibilities of the procurement officer. B. To outline the terms and conditions of a purchase order. C. To establish performance expectations for suppliers. D. To determine the budget for procurement activities. Answer is C. To establish performance expectations for suppliers. Question 36. Which of the following is an example of a strategic sourcing approach? A. Buying goods from a single supplier without negotiation. B. Obtaining quotes from multiple suppliers and selecting the cheapest option. C. Collaborating with suppliers to achieve long-term cost savings and value creation. D. Purchasing goods based solely on the urgency of the request. Answer is C. Collaborating with suppliers to achieve long-term cost savings and value creation. Question 37. What is the purpose of a request for information RFI? A. To seek clarification on a supplier's quotation. B. To request additional documentation from suppliers. C. To gather information about suppliers and their capabilities. D. To initiate a negotiation process with suppliers. Answer is C. To gather information about suppliers and their capabilities. Question 38. A hospital is considering two suppliers for purchasing medical equipment. Supplier A offers a 5% discount on bulk purchases, while supplier B offers a 2% discount on all orders. If the hospital plans to make a single bulk purchase, which supplier should they choose? A. Supplier A. B. Supplier B. C. Both suppliers are equally favorable. D. Insufficient information to determine. Answer is A. Supplier A. Question 39. A hospital has a budget of $10,000 to purchase medical supplies. Supplier A offers a 10% discount, while supplier B offers a $500 discount. Which supplier should the hospital choose to maximize savings? A. Supplier A. B. Supplier B. C. Both suppliers are equally favorable. D. Insufficient information to determine. Answer is B. Supplier B. Question 40. A hospital is comparing the prices of two suppliers for purchasing syringes. Supplier A offers 100 syringes for $50, while supplier B offers 120 syringes for $60. Which supplier offers a better deal? A. Supplier A. B. Supplier B. C. Both suppliers are equally favorable. D. Insufficient information to determine. Answer is B. Supplier B. Question 41. A hospital plans to purchase equipment from supplier A. The equipment costs $5,000, and the hospital will receive a 10% discount. Additionally, supplier A offers free installation worth $500. What is the total cost to the hospital after applying the discount and accounting for the free installation? A. $4,500. B. $5,000. C. $5,500. D. $5,050. Answer is A. $4,500. Question 42. A hospital requires 300 bed sheets. Supplier A offers a pack of 10 bed sheets for $50, while supplier B offers a pack of 15 bed sheets for $75. Which supplier offers a better deal in terms of cost per bed sheet? A. Supplier A. B. Supplier B. C. Both suppliers are equally favorable. D. Insufficient information to determine. Answer is A. Supplier A. Question 43. A hospital purchases a particular medication from supplier A at $2 per unit. If the hospital buys 500 units, the price reduces to $1.80 per unit. What is the total cost if the hospital purchases 500 units? At $900. B. $950. C. $1,000. D. $1,100. Answer is at $900. Question 44. A hospital plans to purchase equipment from supplier A, which offers a 15% discount on the list price of $8,000. However, supplier B offers a 20% discount on the list price of $7,000. Which supplier offers a better deal in terms of cost? At supplier A. B. Supplier B. C. Both suppliers are equally favorable. D. Insufficient information to determine. Answer is B. Supplier B. Question 45. Which of the following is not a step in the procurement process? A. Vendor selection. B. Contract negotiation. C. Budget allocation. D. Supplier evaluation. Answer is C. Budget allocation. Question 46. A hospital has received proposals from 3 different suppliers for a medical equipment purchase. Supplier A offers a price of $10,000 with a delivery time of 3 weeks. Supplier B offers a price of $9,500 with a delivery time of 4 weeks. Supplier C offers a price of $9,700 with a delivery time of 2 weeks. Which supplier would you recommend based on price and delivery time? A. Supplier A. B. Supplier B. C. Supplier C. D. Insufficient information. Answer is C. Supplier C. Question 47. A hospital has decided to implement a new electronic health records (EHR) system. As a procurement officer, which of the following factors would you prioritize when selecting an EHR vendor? A. User interface design. B. Cost of the system. C. Integration with existing systems. D. All of the above. Answer is D. All of the above. Question 48. A hospital needs to purchase 500 boxes of latex gloves. Supplier X offers a price of $8 per box, while supplier Y offers a price of $8.50 per box. Supplier Z offers a discounted rate of $7.50 per box for orders exceeding 1,000 boxes. Which supplier would you recommend? A. Supplier X. B. Supplier Y. C. Supplier Z. D. Insufficient information. Answer is C. Supplier Z. Question 49. During the procurement process, what is the purpose of conducting a request for proposal (RFP)? A. To solicit bids from potential suppliers. B. To negotiate contracts with selected vendors. C. To evaluate supplier performance. D. To allocate budget for procurement. Answer is A. To solicit bids from potential suppliers. Question 50. In a procurement auction, which of the following is the most commonly used type of auction? A. English auction. B. Dutch auction. C. Sealed bid auction. D. Reverse auction. Answer is C. Sealed bid auction. Question 51. A hospital wants to purchase surgical instruments from a supplier. What document would be used to outline the specifications, quantity, and delivery terms for this purchase? A. Purchase order. B. Invoice. C. Bill of lading. D. Statement of work. Answer is A. Purchase order. Question 52. A hospital is planning to implement a new inventory management system. Which of the following factors should be considered during the vendor evaluation process? A. System compatibility with existing infrastructure. B. Vendor's financial stability. C. User training and support. D. All of the above. Answer is D. All of the above. Question 53. Which of the following procurement methods involves obtaining goods or services directly from a pre-selected supplier without competition? A. Competitive bidding. B. Request for proposal (RFP). C. Sole sourcing. D. Reverse auction. Answer is C. Sole sourcing. 54. In a hospital's procurement department, which of the following tasks would be considered a strategic activity? A. Ordering office supplies. B. Negotiating contracts with suppliers. C. Managing inventory levels. D. Reviewing purchase orders. Answer is B. Negotiating contracts with suppliers. 55. A hospital needs to purchase new medical equipment. The procurement officer should primarily focus on A. Finding the cheapest equipment available. B. Ensuring the equipment meets the required specifications. C. Prioritizing equipment from a specific supplier. D. Maximizing the commission from the supplier. Answer is B. Ensuring the equipment meets the required specifications. 56. Which of the following is an example of a direct procurement expense in a hospital? A. Employee salaries. B. Utility bills. C. Medical supplies. D. Marketing expenses. Answer is C. Medical supplies. 57. A procurement officer wants to assess the financial stability of a potential supplier. Which of the following would be the most relevant factor to consider? A. Length of time in business. B. Number of employees. C. Company location. D. Quality of previous products supplied. Answer is A. Length of time in business. 58. A hospital's procurement department is analyzing its supply chain to identify potential risks and vulnerabilities. This process is known as A. Inventory management. B. Risk assessment. C. Supplier evaluation. D. Budget forecasting. Answer is B. Risk assessment. 59. Which of the following is an example of a qualitative evaluation criterion for selecting a supplier? A. Price. B. Delivery time. C. Product quality. D. Payment terms. Answer is C. Product quality. 60. A hospital is implementing a new procurement software system to streamline its operations. The procurement officer's role in this process would primarily involve A. Selecting the software vendor. B. Training staff on how to use the system. C. Customizing the software to meet the hospital's needs. D. Monitoring and evaluating the system's performance. Answer is B. Training staff on how to use the system. 61. Which of the following inventory management techniques aims to maintain stock levels based on historical demand patterns? A. Economic order quantity (EOQ). B. Just-in-time (JIT) inventory. C. First in, first out FIFO. D. Last in, first out LIFO. Answer is A. Economic order quantity (EOQ). 62. A procurement officer receives multiple quotations for a specific item. To ensure fairness and transparency, the officer should primarily consider A. The lowest price quoted. B. The supplier with the best reputation. C. The specifications and quality of the item. D. The supplier who offers the longest payment terms. Answer is C. The specifications and quality of the item. 63. Which of the following is a key benefit of establishing long-term contracts with suppliers? A. Flexibility in changing suppliers. B. Reduced risk of price fluctuations. C. Higher competition among suppliers. D. Lower negotiation power with suppliers. Answer is B. Reduced risk of price fluctuations. 64. A hospital is considering outsourcing its laundry services to an external vendor. Which of the following would be a potential risk of outsourcing? A. Increased control over quality. B. Lower cost of operations. C. Dependence on the vendor's performance. D. Improved efficiency of laundry processes. Answer is C. Dependence on the vendor's performance. 65. Which of the following is an example of a primary source of data for procurement analysis? A. Vendor catalogs. B. Internal reports. C. Market research studies. D. Expert opinions. Answer is B. Internal reports. 66. A hospital wants to purchase surgical gloves from a vendor. Which of the following factors should be considered in the procurement decision? A. Material and size of the gloves. B. Cost per unit. C. Delivery time. D. All of the above. Answer is D. All of the above. 67. A hospital needs to procure a new MRI machine. The hospital management wants to compare different vendors based on their prices and warranty terms. Which type of analysis would be most appropriate for this situation? A. Cost-benefit analysis. B. Financial analysis. C. Price analysis. D. Supplier evaluation analysis. Answer is C. Price analysis. 68. The procurement officer needs to evaluate the financial stability of a potential vendor. Which of the following documents should be reviewed for this purpose? A. Profit and loss statement. B. Balance sheet. C. Cash flow statement. D. All of the above. Answer is D. All of the above. 69. Which of the following is an example of a qualitative procurement evaluation criterion? A. Price. B. Delivery time. C. Product quality. D. Supplier location. Answer is C. Product quality. 70. A procurement officer wants to evaluate the performance of existing vendors based on their on-time delivery record. Which of the following metrics should be used? A. Inventory turnover rate. B. Days payable outstanding. C. On-time delivery percentage. D. Gross margin. Answer is C. On-time delivery percentage. 71. A hospital is considering outsourcing its laundry services. Which of the following factors should be considered to evaluate the outsourcing decision? A. Cost savings. B. Quality of service. C. Security of data. D. All of the above. Answer is D. All of the above. 72. The procurement officer wants to analyze the historical spending patterns of the hospital to identify cost-saving opportunities. Which of the following techniques can be used for this purpose? A. Pareto analysis. B. Regression analysis. C. Break-even analysis. D. SWOT analysis. Answer is A. Pareto analysis. 73. A hospital wants to procure medical equipment and wants to ensure that the vendors meet specific quality standards. Which of the following procurement methods is most appropriate for this situation? A. Request for proposal RFP. B. Request for quotation RFQ. C. Open tendering. D. Single source procurement. Answer is A. Request for proposal RFP. 74. A procurement officer wants to compare the cost of purchasing a product with the cost of leasing it. Which of the following techniques can be used to make a decision? A. Payback period analysis. B. Net present value analysis. C. Return on investment analysis. D. Cost benefit analysis. Answer is D. Cost benefit analysis. 75. In a hospital procurement process, which of the following is an example of direct procurement? A. Purchasing medical equipment. B. Hiring a consultant. C. Outsourcing cleaning services. D. Training staff members. Answer is A. Purchasing medical equipment. 76. Which of the following is an essential step in the procurement cycle? A. Supplier evaluation. B. Patient registration. C. Employee payroll. D. Marketing strategy. Answer is A. Supplier evaluation. 77. A hospital wants to reduce its procurement costs. Which of the following strategies would be most effective? A. Consolidating purchases with multiple suppliers. B. Increasing the number of suppliers. C. Ordering goods in smaller quantities. D. Implementing just-in-time inventory management. Answer is A. Consolidating purchases with multiple suppliers. 78. The Pareto principle, also known as the 80-20th rule, suggests that 80% of the hospital budget should be allocated to procurement. B. 80% of procurement issues are caused by suppliers. C. 80% of the hospital spending is driven by 20% of the items. D. 80% of the procurement process should be automated. Answer is C. 80% of the hospital spending is driven by 20% of the items. 79. Which of the following is a benefit of conducting a competitive bidding process? A. Increased supplier loyalty. B. Reduced transparency. C. Lower procurement costs. D. Lengthy procurement timelines. Answer is C. Lower procurement costs. 80. A hospital wants to analyze its procurement data to identify trends and patterns. Which of the following tools would be most useful? A. Balance sheet. B. Cash flow statement. C. Pareto chart. D. Income statement. Answer is C. Pareto chart. 81. When evaluating potential suppliers, a hospital should consider which of the following factors? A. Supplier's annual revenue. B. Supplier's location. C. Supplier's social media presence. D. Supplier's charitable donations. Answer is B. Supplier's location. 82. A hospital procures medical supplies from 3 different suppliers. Supplier A provides 40% of the total supplies, Supplier B provides 30%, and Supplier C provides the remaining 30%. What percentage of supplies does Supplier A provide compared to Supplier C? A. 30%. B. 40%. C. 50%. D. 60%. Answer is B. 40%. 83. Which of the following is an example of a just-in-time procurement strategy? A. Stocking up on supplies during a sale. B. Ordering supplies in advance of a predicted demand increase. C. Ordering supplies as needed to minimize inventory. D. Placing large bulk orders to take advantage of discounts. Answer is C. Ordering supplies as needed to minimize inventory. 84. Which of the following is a disadvantage of decentralized procurement? A. Increased control over the procurement process. B. Lower administrative costs. C. Lack of standardized processes. D. Reduced coordination between departments. Answer is C. Lack of standardized processes. 85. A hospital procures medical supplies from 3 suppliers, Supplier A, Supplier B, and Supplier C. Each supplier provides a different percentage of the total supplies. If Supplier A provides 40% of the supplies and Supplier B provides 25% of the supplies, what percentage of the supplies does Supplier C provide? A. 15%. B. 20%. C. 25%. D. 35%. Answer is A. 15%. 86. The hospital procures surgical instruments from 3 manufacturers, Manufacturer X, Manufacturer Y, and Manufacturer Z. If 40% of the instruments are procured from Manufacturer X and 30% are procured from Manufacturer Y, what percentage of the instruments is procured from Manufacturer Z? A. 10%. B. 20%. C. 25%. D. 30%. Answer is B. 20%. 87. A hospital needs to purchase new MRI machines. The machines are available in 3 different configurations: Configuration A, Configuration B, and Configuration C. Configuration A costs $150,000, Configuration B costs $200,000, and Configuration C costs $250,000. If the hospital plans to purchase 2 Configuration A machines, 3 Configuration B machines, and 1 Configuration C machine, what is the total cost? A. $650,000. B. $700,000. C. $750,000. D. $800,000. Answer is B. $700,000. 88. The procurement department of a hospital has received quotations for purchasing 500 units of a particular medication. Supplier X offers a unit price of $10, while supplier Y offers a unit price of $12. If the hospital selects supplier X, how much money will it save compared to choosing supplier Y? A. $500. B. $1,000. C. $1,500. D. $2,000. Answer is C. $1,500. Question 89. The hospital recently conducted a survey to assess patient satisfaction. Which of the following would be the most reliable indicator of patient satisfaction? A. Length of stay. B. Number of patient complaints. C. Number of discharged patients. D. Patient feedback surveys. Answer is D. Patient feedback surveys. Question 90. A hospital purchases medical supplies from multiple vendors. Which of the following strategies would be most effective in reducing procurement costs? A. Increasing the number of vendors. B. Consolidating purchases with fewer vendors. C. Maintaining the same number of vendors. D. Purchasing from local vendors only. Answer is B. Consolidating purchases with fewer vendors. Question 91. A hospital wants to implement a new inventory management system. Which of the following would be the most important factor to consider? A. Cost of the system. B. System compatibility with existing software. C. Availability of customer support. D. System scalability. Answer is B. System compatibility with existing software. Question 92. The hospital wants to evaluate the efficiency of its procurement process. Which of the following metrics would be most useful for this purpose? A. Number of purchase orders processed. B. Total value of purchases made. C. Average time taken to process purchase orders. D. Number of vendors contacted. Answer is C. Average time taken to process purchase orders. Question 93. A hospital is considering implementing a just-in-time (JIT) inventory management system. Which of the following benefits is associated with JIT? A. Reduced storage space requirements. B. Increased order quantities. C. Longer lead times for supplies. D. Higher inventory carrying costs. Answer is A. Reduced storage space requirements. Question 94. A hospital needs to purchase a new MRI machine. Which of the following factors should be given the highest priority when evaluating different vendors? A. Price of the machine. B. Warranty and maintenance options. C. Delivery time. D. Reputation of the vendor. Answer is B. Warranty and maintenance options. Question 95. The hospital wants to improve its procurement process by implementing electronic procurement e-procurement methods. Which of the following is a potential benefit of e-procurement? A. Increased paperwork and manual processes. B. Higher processing time for purchase orders. C. Improved accuracy and efficiency. D. Reduced reliance on technology. Answer is C. Improved accuracy and efficiency. Question 96. A hospital is experiencing frequent stockouts of critical supplies. Which of the following actions would be most effective in addressing this issue? A. Increasing the reorder point of supplies. B. Implementing a just-in-case inventory strategy. C. Improving demand forecasting methods. D. Reducing safety stock levels. Answer is C. Improving demand forecasting methods. Question 97. The hospital is considering outsourcing its procurement function to a third-party company. Which of the following is a potential disadvantage of outsourcing procurement? A. Reduced cost savings. B. Increased control over procurement activities. C. Improved supplier relationships. D. Loss of in-house expertise. Answer is D. Loss of in-house expertise. 98. A hospital has 3 suppliers for medical equipment: Supplier A, Supplier B, and Supplier C. The hospital needs to purchase 3 types of equipment: X, Y, and Z. Based on the following conditions, determine which supplier provides which equipment. Conditions. I. Supplier A provides equipment X. E. Supplier B provides equipment Y. E. Supplier C does not provide equipment Z. Which of the following arrangements is correct? A. Supplier A, X, Supplier B, Y, Supplier C, Z. B. Supplier A, X, Supplier B, Z, Supplier C, Y. C. Supplier A, Z, Supplier B, X, Supplier C, Y. D. Supplier A, Z, Supplier B, Y, Supplier C, X. Answer is A. Supplier A, X, Supplier B, Y, Supplier C, Z. 99. A hospital needs to purchase 5 types of medical supplies: gloves, masks, syringes, bandages, and gauze. The following conditions apply. Conditions. Conditions. I. Gloves must be purchased before bandages. E. Masks must be purchased before syringes. E. Gauze must be purchased after bandages. Which of the following sequences is correct? A. Gloves, bandages, masks, syringes, gauze. B. Gloves, masks, syringes, bandages, gauze. C. Bandages, gloves, masks, syringes, gauze. D. Bandages, gloves, syringes, masks, gauze. Answer is C. Bandages, gloves, masks, syringes, gauze. 100. The procurement officer needs to categorize the hospital's inventory into 3 types: pharmaceuticals, surgical instruments, and laboratory equipment. The following conditions apply. Conditions. I. All laboratory equipment is categorized as scientific instruments. E. Surgical instruments are not categorized as pharmaceuticals. E. Some pharmaceuticals are categorized as surgical instruments. Which of the following statements is true? A. All surgical instruments are pharmaceuticals. B. All surgical instruments are laboratory equipment. C. Some surgical instruments are pharmaceuticals. D. Some pharmaceuticals are laboratory equipment. Answer is C. Some surgical instruments are pharmaceuticals.